I'm Matt Willis, Public Health Officer, with an update for November 15th. COVID-19 case rates are rising again in Marin and across the region. I'm going to explain why our greatest vulnerability is that we are still basically under-vaccinated as a community relative to the threat of Delta and the winter holidays, even though we're the most vaccinated county in the state. The first thing we ask when we see numbers go up like this is this a meaningful trend? The kind that might require a change in our public health strategy, or is this just a blip in our progress? Looking outside of Marin helps answer that question. Regionally, case counts are also rising. The whole Bay Area is now in the CDC's orange tier of substantial transmission. Looking at other countries with high vaccination rates in the Northern Hemisphere, we see case rates are also rising, especially across Europe. Taken together, our increases locally, regionally, and globally. The unfortunate message is that our winter surge has begun in Marin. Case rates in Marin have increased from 13 cases per day on average to 20 cases per day over the past 10 days. So what does that mean for us? We look again to Europe to offer some lessons. Broadly speaking, Western and Eastern Europe are experiencing distinct patterns. In most Western European countries, vaccination rates are higher, more like Marin County. While case rates are rising in these communities, the link between case rates and hospitalization rates has weakened, and their health systems are not, by and large, overwhelmed. That's because, as vaccinated people can be infected and get counted as a case, they experience generally milder symptoms and are well protected against hospitalization and death. In Eastern Europe, by contrast, where trust in vaccinations is lower and rates are much lower of vaccination, cases are also surging, but it's going along with an overwhelmed hospital system and record death counts because more of those infected are unvaccinated. For Marin, the lessons are this. As we come into winter, unfortunately, we should anticipate that the virus will continue to flow in Marin as it has and is in similar settings globally. We see from our own experience and from the example of the two pictures in Europe that vaccinations are the safest way to weather a winter surge for us as individuals and as a community. That's why anyone who was vaccinated more than 6 months ago is now eligible for a booster following new state guidance. In Marin, our public health vaccine clinics will be prioritizing two groups at either end of the age spectrum. First, children age 5 to 11 are finally getting the protection of the vaccines, and it's just in time. Though 5 to 11-year-olds make up only 8% of our population, they make up half of our cases among unvaccinated people. That's a very high priority for us to close that gap, and it's a relief to see over 6,000 of our kids have been vaccinated just in the past 10 days. For preventing hospitalizations and death, the highest priority is our older residents and those with medical conditions. We know vaccine immunity wanes over time, and these groups were vaccinated first, most over 8 months ago. Among people who end up hospitalized who are fully vaccinated, about 80% in Marin are over age 65. So because older residents are at much higher risk for breakthrough hospitalizations, we strongly recommend a booster dose. As of today, unfortunately, only 50% of our residents over age 65 who were vaccinated more than 6 months ago have gotten their booster. The next few weeks will be important for us as we race to optimize the protection of vaccines through the winter holidays. In future messages, we'll reinforce other things we can do to ensure safer holidays. But for now, the most important message is this. 1, for anyone who is unvaccinated, gain the protection of the vaccine as soon as possible, especially our newly eligible kids ages 5 to 11. And 2, for our most vulnerable residents to get boosted, especially those over age 65. New appointment slots are opening every day for eligible age groups online at myturn.ca.gov or at getvaccinatedmarin.org or through your healthcare provider or pharmacies. Thank you all again for doing your part.